All right, good morning. Here we go. There we are. As always, just waiting for the tech to catch up. Hope you guys are doing well. Happy Wednesday. I love Wednesdays. Wednesday is coaching day for me, so I get to spend time with my lovely clients, which is just awesome. Big welcome to everybody. Good morning. I am Melissa Merchant. I am an integrative cancer coach, ex-litigation lawyer, host of this group, and creator of various cancer coaching programs to support you at any stage for almost every budget. That is my goal. And I run a whole series of free events here in the group every month. And this is one of them. This is Calm After Cancer, a fear reset challenge. We are all very familiar with the fear. So it is really important here on day 3 that we think about what we're going to be doing. We need to rewire the pattern because the fear that we experience after cancer is actually just biology. It's biology. It's a physical threat, and you feel it, and your brain catches up and it feels that threat. And then we have the triggers. Did you know that actually about 5 years ago, a major psychology organization in the US designated the trauma that cancer patients go through, which, by the way, ramps up usually after treatment, as a form of PTSD for many, but it's not the standard PTSD. So they now have a designated category for a special kind of PTSD that is just for us, because that's what it is. It's post-traumatic stress disorder because you went through a trauma. You went through trauma. And one of the difficult things is that people around you quite often with the best will in the world will say things like, you're fine now, you're done, it's over, you're good. But we don't hear that. And in fact, sometimes it made me quite angry because they didn't get it. And then it can be really isolating, right? Because you can't really share how you really feel with the people that are closest to you, either because you don't want to get back what you normally get back. You're fine. It's all good. You'll be great. You look awesome. All the things. Or because you don't want to freak out the people closest to you. And so what do? You internalize it. And like we've been talking about all week, fear does not go away by itself. It kind of bubbles and festers under the surface. So, welcome. We're going to take yet more steps to move through that fear because that is what we need to do. We need to move through it. We're not going to go around it. That's not going to work. We got to go straight through it. So, hopefully, you have your workbooks because all of the exercises that I talk about are in the workbooks. But here's the other quick thing I want to say before we totally dive in today. This stuff is hard. It sounds easy. Oh, do your breathing, da 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 da, but it's hard. And it's hard for a couple of reasons. One, because sometimes people don't want to acknowledge that they're feeling the way they're feeling, so they're not willing to do the exercises to get out of the way they're feeling. Or secondly, and most commonly, you kind of minimize the power of this stuff because it sounds really simple. And trust me, that was me. Okay, I talked about it before, but my background's in law. I am that person. I'm very practical, very common sense. I wouldn't consider myself, a very woo-woo kind of person naturally. But like I said yesterday, the joke is on me because this is the stuff that makes the biggest difference. Mindset is everything. Yeah, you can eat all the broccoli, you can do all the exercise, but if your mind doesn't catch up with the actions that you're taking to help yourself, you got a problem, a big problem. So please don't dismiss this stuff because it sounds really hokey and I'm telling you to like just sit in a quiet room and breathe in a particular way, or, to calm your mind with various exercises. This is work and you got to do it. And like everything in life, the more you do it, the better you get. The more you do it, those tiny shifts add up over time. I dedicate the first 10 minutes of my day to just lying in bed as soon as I wake up, or, wake up and doing some breathing exercises. I would have laughed at you 10 years ago if you told me I would be doing them. But it makes all the difference to my mindset for the day. I do the same at night, and it makes all the difference to how I sleep, which, by the way, is when your mind processes everything. And it's also when your body takes out the trash, right? When your immune system does its work. So, sleeping, breathing, we take these things for granted. These are powerful tools. So, please do it. Just 10 minutes a day. But also remember our micro groundings and our full groundings that we did yesterday. Practice those so that when you need them, they're there for you. Because I tell you, I wear an Oura ring. It's just like a Fitbit kind of tracker. I watch my heart rate decrease. I watch my blood pressure go down. This is not hokey woo-woo stuff. This is science, right? So anyway, there we go. I'll get off my soapbox now. All right. So hopefully you all have your workbooks. If you registered for this challenge, those would have been sent to you. So we are on day 3. And today we're going to practice a catch, check, and choose loop. For those thoughts, don't worry, I'll explain. And then we're going to add a little tiny attention tilt with gratitude, right? Gratitude is incredibly powerful. Gratitude and positive affirmations, breathing, grounding, the way forward. We're not hunting for perfect thoughts. So I don't want you to think you're a failure if those little niggles creep in. Of course, they're going to creep in. I try to be totally transparent. I overate on the weekend. I ate too quick, a tendency. I grew up with brothers that used to steal my food. So I tend to gobble. And of course, afterwards, I have a sensitive stomach. I've lost 3.5 feet of intestines. So I need to be careful. And what did I do? I inhaled my food. I felt kind of rubbish afterwards. I had a little stabbing pain in my gut. And of course, my first thought, there's a tumor there. But no, the more likely explanation was I just ate a full meal in about 30 seconds. That is more likely. So we're not hunting for perfect thoughts. We're building a better reply, because that's what we're going to do. We're going to reply. But first, I want to talk about why your thoughts sound so convincing and how to answer back. I literally wanted you to separate yourself from your thoughts. I know this sounds weird. Separate yourself from your thoughts. Like actually listen to your thoughts and critically evaluate them. Your brain got really good at spotting danger because you felt weird. Maybe you had the mammogram, you went to the doctor, you got a test result, whatever, however it led up. Then you got a diagnosis, right? Danger. Your brain immediately starts sending danger signals. And then you got to go for the tests, the scans, the blood tests, the treatments, the scans again. And it's that you're in a fear loop. Of course you are. There's no other way to get through this. Your brain was being trained. Nothing we can do about it in the moment, but your brain got really good at spotting danger. And it was that vigilance that helped get you through treatment. The threat radar, though, the side effect of all of this now is you have a threat radar and it keeps pinging, even when you're at home cooking dinner, like me, after a meal, or you're trying to sleep. That's why a twinge turns into catastrophe in one leap. Me going, ooh, just ate a huge meal, ate it too quick, but ooh, my cancer's back. Like saying that out loud makes zero sense. But that's what my brain did because it's been trained. So a twinge can turn into a catastrophe just like that. A clinic delay, for whatever reason, feels like a disaster. Okay? A date in the calendar for an upcoming scan, you just happen to notice it as you look at your upcoming week and you get that chest tightening. There's nothing wrong with you. Your alarm is set to sensitive. Today is about learning how to answer that alarm, but don't argue with it. So swap, I'm overreacting with my alarm is loud because it loves me, right? That alarm is there for a reason. We just need to reassure it, right? We need to hit snooze. Okay. So, how can cognitive behavioral therapy actually help? What does it actually do to you? We're not telling you, our answer to fear of recurrence is not just think positive. I tell you, I would have slapped the next person who told me, just be optimistic, just be positive. Yeah, like it's easy, like to flip a switch. I finally, one person was really difficult, and I found myself saying, I'd love, what would happen if this was you? How would you feel if you acknowledged how you were really feeling and people just dismissed it all the time and just told you, think positive, right? So contemporary cognitive behavioral therapy for fear of recurrence isn't about thinking positive. It's about being a detective, right? We want to catch the thought. Think of yourself as separate from your thoughts. Catch that automatic thought. It's back. Check it against evidence for and against. We're not trying to lie to ourselves. We're checking it for facts. I ate a huge dinner. I ate it way too quickly. I had carbonated water with it at the same time. I felt full and bloated afterwards, and I had a little pain. Is it more logical that that was the cause of the pain, or that my cancer, after 8 years of clear scans, is back? Check for evidence for and against, and choose a kinder, still true line that guides you as to what to do next. You don't want to deny it. You don't want to lie to yourself, right? Because there's certain situations, of course, where maybe there is some evidence for it. Maybe there's some evidence against it. So you don't want to lie to yourself. So you're not denying risk. You're going to right size it so that your day doesn't get hijacked. We all have had those days. So there are thinking traps to watch out for. Catastrophizing is one of them. We are hardwired to catastrophize, especially when we have history that justifies it, just even a little, to our brains. That's our brains doing its job, scanning for danger, right? So catastrophizing is when you jump to the worst case only and you just dismiss everything else. It's like me saying after my big dinner when I ate too much, well, clearly my cancer's back, and you just will not accept any arguments to the contrary, even though they're the rational ones. Catastrophizing, jumping to the worst case only. Or maybe another trap is, this is a big one, fortune telling, I call it. You got a scan coming up in the week. I know the scan will be bad. No, you don't. You have no idea. You have no idea. You might, clearly there's circumstances where you're like, okay, well, maybe it will be, depending on your circumstances. But you don't know that. You're fortune telling. You're anticipating something that hasn't happened yet. If a child did that, I'm going to be terrible in that school play on Friday, Mom. I'm going to be terrible, despite your child having read their lines perfectly for weeks. What would you say to that child? Say that to yourself. Or the all or nothing. This is another one, another trap. If I'm not 100% well, I'm failing. Now, this is a really difficult one, and I've had personal experience with this because I had to live with tumors in my intestines for 2 years while my team waited for them to grow before surgery. My active treatment had finished. I knew I wasn't 100% well, and I felt like a failure. No, you got to change that mindset. I might have been 75% well. Well, that's not bad. And it was certainly progress over what I was before. So that all or nothing mindset is also a trap. Mind reading is another one. Oh my gosh, I remember this well. I watch my radiologist's eyes like a hawk. I'm lying in a scanner and my head's on permanent swivel watching them through the glass. And they might be having a conversation as they're clicking the clicks and doing the things and pushing the buttons. But I'm looking at them like, oh, well, look at their face. Clearly, it's a disaster. There's tumors everywhere. It's a nightmare. They're probably discussing lunch, you know? Don't mind read. It's not going to help you. So another one is emotional reasoning. That's another trap. I feel like you're using your own emotions to justify your own emotions. I feel scared, so the cancer must be back. The danger is present. Or this is the nightmare one, hyper vigilant checking. If I just keep checking the portal, I'm being responsible. In your workbooks, think like journal about this. Which trap is you? What trap do you fall into most? For me, catastrophizing, fortune telling, and mind reading, those are my big ones. But just recognizing that you do that increases that separation between those thoughts and you. And just noticing it loosens its grip. This is neuroscience. If you write the scary thought down, right, you catch the automatic thought, you write it down. Then you examine the evidence, you check it against evidence for and against. You actually recruit your prefrontal cortex, your reasoning, the reasoning part of your brain. All these negative thoughts happen in the emotional regulation center of your brain. As soon as you do exercises like this, especially if you write it down, and I don't mean type it, it's better if you write. In order to do that processing, it has to move from the emotional center of your brain to your prefrontal cortex, the reasoning part of your brain. And you know what happens 100% of the time? Those thoughts lose power and it increases the separation, right? So as soon as you've moved from the emotional side to the prefrontal cortex through the catch check mechanism, right? And especially if you write it down, that dampens your amygdala's siren, that siren that's going off, and gives your nervous system a nice back rub, right? And each repetition that you do this lays a stronger pathway preference. The more you do it, this exercise, catch, check, especially if you write it down, your brain will remember that, oh, she doesn't want us to activate our emotional side of her brain, our amygdala. We're going to be rational about this. It learns. It lays down a stronger pathway preference. You're teaching your brain. Your brain can be rewired. So body first, then thought work, right? So let's walk through a couple of examples of the catch, check, choose loop. So example one, you have a body cue. So maybe your trigger was you have a backache after lifting shopping. your automatic thought is it's back. Evidence for that could be maybe it's a new ache and it was really intense. And maybe you have some family history that might push towards a negative result. But the evidence against is that you lifted a really heavy bag, you didn't take care of your body when you do it, you were twisting and bending over without bending your knees. It gets better with that heating pad that you put on. Your last scan was no evidence of disease and you have no other symptoms. So you want to give yourself a kinder but still true line. New pain deserves attention. I'll track it today and call my team if it persists or worsens. Even just reading this, I feel myself going, oh, okay. Yeah, that makes sense. Right? And I'm more calm. You got to give that a go. Example 2, the admin of cancer. So your trigger is the clinic portal is slow. You're not getting that phone call. They're late in giving you results, or there's nothing on your clinic portal and they told you that it would be there. And your auto thought, well, they're delaying it because it's bad, right? 4, what's the argument for that? Well, delay, the nurse looked really focused on her last visit. She's on it. So, it's not an admin thing. Clearly it's a nightmare. They just don't want to tell me. Against would be staff's busy. The cancer system is unbelievably overwhelmed. Portals glitch. I've had normal delays before. Oh, again, I can feel myself just relax. That's perfectly reasonable. Not easy, but perfectly reasonable. So what's the kinder, still true line? Delays are common. I'll follow my results day plan that we talked about yesterday. I'll not check all day. I'll check at 6 p.m. and then I'll stop and message the team tomorrow if there's still no update. Perfectly reasonable. You're not dismissing everything as being irrational. You're reframing. You're teaching your brain not to default to panic. Can you see what I'm doing here? Even better if you write these things down and you write down the for and against evidence. But remember that last piece, that you give yourself a kinder but still true line. So I'd love for you to do the exercises in your workbook about that. Write a trigger, write your automatic thought, think about what are the arguments for it being correct? What are the arguments against it being correct? And give yourself a kinder, still true line. Keep it short and keep it believable. Your brain will just go, oh, thanks, right? Thanks. Now, I do want to stop here and tell you a story. During the 2-year wait for my tumors to grow, I had a scan and then I was back at work. I'm not doing what I do now, but I was doing child protection stuff. And I was sitting there at my desk and my phone rang. It was my oncologist's office. And I just had the scan the day before. And it was my oncologist's office. And they said, Melissa, we need you to come back downtown Toronto right now. Okay, we have your scan results. They need to be discussed today, and we need to take action today. Well, total panic stations, obviously. Called my sister-in-law, arranged her for pick up my kids. I didn't know what was happening. It was like 10:30 in the morning. I got to drive downtown. Traffic's a nightmare in Toronto. So I was like, oh my God, it's like 30 minutes, but it could be an hour and a half. Who knows? I'm driving. I'm one exit away. And my oncologist's office calls me back and they said, sorry, wrong person. Can you imagine? Not going to lie, I lost my mind. And I said, well, listen, I'm 10 minutes away. You are going to get my scan and you are going to get the team and you are going to walk me through everything and you're going to reassure me, because I literally have been in full panic motion, panic for the last 2.5 hours. And now it's your job to reassure me. I wish I'd had these tools then, because I literally thought I was dying. I literally thought this was a disaster. My kids were going to be in foster care. Like, it just, I went from 0 to 100. And when I got there, my pulse was 160 some odd beats a minute. Like, I thought I was hyperventilating. It was awful. And I'm a pretty tough cookie. It was awful. They were unbelievably upset and apologetic, but the damage was done. And so every time I see, for years afterwards, every time I saw my oncologist's name come up on my screen, it wasn't good. Started doing this stuff, doesn't bother me at all now. I've retrained my brain, right? Now, my scan that time, my tumors had been shrinking. I was feeling great. I'd lost weight, the right kind of weight. I had more energy, like things were better than ever. My blood results were stellar. I'd been working really hard at them. And like I said, my tumors were shrinking. I had zero evidence that this was likely, but I defaulted to panic mode. I wish I'd had these tools. So, how do you gather evidence? Well, to avoid cherry picking, right? Because it can be really hard. I want you to think about using time windows. In the last 72 hours, how have I felt? What have I seen in response to some panic cue? Check patterns. What happened last week at the scan? I've been feeling really, really well. My last 3 scans have been clear. My blood tests are good. Like, check patterns over time. Pull outside data. What did your discharge notes say? Read them again. No evidence of disease. Or your symptom tracker. Yeah, look, gosh, I've been ticking off. I've been drinking the water. I've been doing the exercise. I'm sleeping great. Like, look at the data. And if the evidence is unclear, because I wanted to acknowledge that that sometimes can be the case where you're like, oh, if the evidence is unclear, you can still use a kinder line for yourself. Include an if then. If the symptoms last 48 hours or worsens, I'll call my team. That's responsible, because we do have to be vigilant, but it's also kind, right? Remember, believable lines beat shiny affirmations. I love affirmations, but if you don't believe them, if they're so dissociated from reality, there's some benefit to them, sure. The neuroscience of manifestation and that sort of thing, not the woo-woo manifestation about the universe owes you something, but the neuroscience about manifestation. Okay, cool. But for our purposes, your brain will reject what it can't believe. So you can use qualifiers. You can write lines that begin with, even with cancer, I can, maybe you're living like cancer, like I was, or even with fear here, maybe that's you, I can make one steady choice. Or this is my favorite. Start with, right now, like in this moment, right now, I can soften my jaw, lengthen my breath, do something for myself. Or today I will, maybe today I will follow my portal rule after 8 p.m., where you don't check it after 8 p.m. If you wouldn't say it to your best friend, it's probably too shiny, right? So believable lines, not the shiny affirmations, those super, super unrealistic positive ones aren't helpful in the longer term. In the immediate term, for these purposes, believable lines beat those shiny affirmations. Now, the next step to all of this is to add a tiny gratitude. Attention is trainable. So when you name 3 sensory concrete goods, like a warm mug, a soft jumper, as we call them in the UK, soft sweater, a lovely light on the wall, you nudge the brain to register safety and support. It's the grounding that we talked about yesterday, not just the threat. And this isn't be grateful and hush. It's widening the frame so danger isn't your only channel, because it feels like it's the only channel, doesn't it? Right. So we've talked about this repeatedly, deliberately. Look around, name 3 pleasant or neutral things that you can notice right now. It's a beautiful sunny day in Toronto. I'm looking out at a maple tree and the leaves are bright orange and the sunlight is shining through it. Cool. You can see the lighting rigs in my office shining in my glasses. They're new. They're so much easier than my last ones. Love them, right? I've got my little diffuser running. My air smells like cinnamon. I love it. Nice fall, cozy day. Tiny gratitude. I love tiny gratitude. And you know what? I love tiny gratitude to myself, right? What small thing can you do for yourself today that will make your life easier for you tomorrow? And you'll be grateful to yesterday's you for doing it. That could be doing the dishes before you go to bed so that you wake up to a clean house. It could be, laying your clothes out so you don't have to make any decisions first thing in the morning. It could be setting the coffee maker before you go to bed. But the next day, I want you to go, God, I'm good. Right? Oh, good job, Melissa. Yeah, be grateful to yourself, right? Now, we also talk in the workbook about results waiting, because that's one of the hardest things. So I just wanted to really quickly talk about that. And there's an exercise in your workbook. I want you to write a short paragraph for future you when the portal is loading, when you're waiting for that phone call. I want you to acknowledge, ground, and choose. So acknowledge, of course, I'm scared. That's normal. Grounding. What are you going to do? You're going to feel your feet. You're going to feel your seat. You're going to feel your hands. Going to do a nice long exhale. And then choose. If I'm clear, I message my team. Say you're waiting for portal results and it comes up in radiologist speak and you have no idea. I had a client call me in a panic asking me what unremarkable meant, because she was like, is that good? Is that bad? I'm like, unremarkable is awesome. Means you're not special and you don't want to be special to a radiologist, right? Unremarkable is good. But maybe you don't understand. Like my client, is all gobbledygook and she got overwhelmed. So I deciphered it for her. But choose. If it's unclear, I'll message my team. You'll get your answer. If it's good, I let that be true for today. And reading your own, because you've written this to future you, right? So reading your own words the next time, you can stop that spiral. You can stop that spiral. Okay, so you've got some exercises in your workbook. There's the journaling, the catch, check, choose. You're going to use the template for one sticky thought. Identify your trigger, what your automatic thought is, the evidence for and against. And you're going to identify your kinder, but still true line, because this is your most evidenced back micro skill. It right sizes risk. Doesn't dismiss it with false positivity, but it right sizes risk and it trains your brain. You gotta do it, especially when you're not in a panic, because you got to get good at it so that when you are in a panic, these exercises, your brain immediately goes, yes. Ooh, right? And like it's magic, but you have to practice it. You're also going to choose 3 authentic, not super shiny affirmations. 3 lines that you could believe on a bad day. You want them to be short. You want them to be kind. You want them to be specific. So example, even feeling the way I'm feeling, even feeling the fear here, I can breathe out longer than I can breathe in. Today, I'll follow my portal rule, not checking after 8, especially not at 2 a.m. Or my body's been through a war. I can sit down with a mug of tea and offer it warmth and rest. And then you're going to do a tiny gratitude exercise where you list 3 sensory things that you appreciate, appreciate now. It doesn't have to be full on, oh, thank you. It could be, yeah, amazing, cool, love it. It could even be neutral. Yeah, awesome, right? And then you're also going to have your results waiting script. You're going to write your paragraph to read the next time you're sitting there waiting for a phone call. This is the acknowledge, ground, choose. You're going to keep it visible. I would suggest you even keep it in your phone notes so that if you're sitting in a clinic waiting room and this sounds like a lot, but really this will take you 10, 15 minutes. You're also going to have a safety note for yourself. Sometimes, writing can spark some overwhelm. Okay. So I want you to give yourself permission to, just pause if you start feeling overwhelmed doing these exercises. Because I recognize some people, that there's a scale of where people are on the anxiety spectrum. So if you find these exercises make you feel panic, take a minute. It'll be okay. I do want you to keep going, but I want you to do your day 2 micro grounding exercises, right? Calm yourself down, give yourself a break, walk away, and return later. Of course, if distress persists, then you need help beyond obviously what a 5-day challenge can do for you. So I would always just want to be responsible. And if you feel distressed, that's different. It's different. So please contact your clinical team. So it's been a lot today. Good work. You're building a steadier default reply to fear, one honest sentence at a time. Tomorrow, we're going to start putting everything together and we're going to turn all of these tools that I've talked about into a resilience routine, I wanted to call it. You're going to have a good day menu. You're going to have a low spoons menu where you just have 0 bandwidth. And you're going to have a 2-minute SOS exercise for those big wobbly moments. Those big wobbly moments, the more you do this, the fewer of those you will have. Right. So I will see you tomorrow. Love you.